Hey everyone, welcome to Talk About Pain, and today we're going to talk about exercises that I use to strengthen the back and the core, especially with regards to back and sciatic pain. And you can imagine, as a physical therapist, I've been a physical therapist for over 25 years and I specialize in chronic pain. And in particular, I see a lot of back and sciatic pain patients because I believe that's one of the most commonly misunderstood diagnoses out there. And so over these years, I've developed my own approach to solving back and sciatic pain. And of course, I've written a book and, well, a few books. And I have these digital home programs to help people solve their back pain and so forth. However, invariably, if I go to a party, if I'm meeting someone on the street and find out that they have back pain, when I get email questions in, it's always, what exercises can I use to strengthen my back and core to eliminate my back pain? And so I thought, let's do a podcast about this because it's literally the most common question I get. So I think to answer this first, I want to explain to you my take on why back pain is occurring in the first place. And this will help you understand what I'm about to tell you. Really, what I think it's easiest to, rather than just explain what I think about back pain, it's best for you to feel why you have back pain. And so I'm going to take you through a couple tests to help you understand the sources of your back pain right now, and then it'll help you understand exactly which exercises, back and core strengthening exercises, you should be doing. Okay. So the first test is this. It's very simple. All you're going to do is you're going to lie down on your back. And for those of you listening to the podcast, I have this as a video on YouTube. So if you go to Rick Olderman on YouTube, you'll see this video. Okay, and I'll try and put the link in the show notes in the description of this podcast so you can go there directly. All right, so you're lying on the ground and I want your legs to be straight like this. And I want you to get a sense for how your back feels in this position. All right, you're lying on your back, and you can even put your hand underneath your low back to feel the arch there if you like. And we're going to stay here for just a few seconds, long enough for you to feel whether this feels like a good thing or not a good thing. Okay? And let's say you've been here for 30 seconds or so. What I'm going to ask you to do now is just go ahead and bend your knees so your feet are flat on the floor and see how your back feels there. And if you're not sure, go ahead and bring your knees all the way to your chest and hug them with your hands and feel how your back feels there. All right, now one of these two positions is going to feel better for you, either legs straight or with knees bent, regardless of whether your feet are on the floor or to your chest. So 99% of you watching me right now will say that your back feels better with your knees bent or your knees hugged to your chest rather than with your legs straight. Why is that happening? Well, the easy answer is the fact that your back is more arched when your legs are straight and your back is less arched when your knees are bent. And if you want to test that, go ahead and do that. Straighten your legs back out, feel that space underneath your low back, and then when you bend your knees, you'll feel that that low space has lessened, and so your back is flatter. So the easy answer to this is that, we need to do a strengthening exercise that flattens your back. Well, that's only part of the answer. So yes, the back needs to be flatter, but often it's not the strengthening that's the problem. So I call this pattern an extension pattern. Extension means arching. And so what this is an extension problem. So you have a problem with too much arch in your back. And you just found out on the floor that if all we have to do is eliminate a little bit of that arch or the forces creating that arch, and your back feels a lot better. So that's kind of where we're going to be going with the back and the core strengthening exercises. All right, they're going to be exercises that help you naturally flatten your spine and turn on your core. We don't want to do exercises that are artificial because if you're distracted, for instance, texting on your phone or watching videos or just walking around and saying hello to someone, you'll forget immediately about that exercise to hold your back in a flatter position. And so what we'd rather do is fix the problem naturally so you don't have to think at all about it. It's just occurring naturally as part of how you use your body. So the extension problem that we're talking about explains more central back pain. Okay? It's one of the keys to almost all back pain is understanding that this is the phenomenon that's occurring. All right, now there's one more phenomenon that's occurring that's causing most unilateral back pain on one side, or sciatic pain or SI joint pain. And that is something called a side bending problem. And what that is one side of the pelvis is higher and one side of the rib cage is lower. And usually it's the same side. So that increases compression on that side of the spine. Well, the nerve roots that are coming out of that side of the spine comprise the sciatic nerve, which then causes sciatic pain and SI joint pain. Usually, this is due to a problem in the same side leg in probably 80 to 90% of the cases. Your brain is trying to get off of whatever problem this is here, this old problem that you haven't addressed correctly. And so what it does is over time it hikes that pelvis up and gets you off that problem. Okay, but it's then created this side bending problem as a result, and so you develop the sciatic pain eventually. This is often, by the way, misdiagnosed as a leg length discrepancy problem because practitioners will see that one side of the pelvis is higher and assume that, oh, you must have a longer leg on that side. Absolutely incorrect. That is typically not the case. And so I can't tell you the hundreds of patients I've seen over the years who have come in and said, oh, well, I've got a leg length discrepancy at the root of my problem. And I'm just like, And when I measure them, I've only measured maybe 2 or 3 people out of hundreds, if not thousands of patients over the last 20 plus years who actually have a true leg length discrepancy. What they actually have is a side bending problem. And the practitioner is only judging you as having a leg length based on the height of your pelvis, not the functional rotations that are occurring throughout your lower body in relation to old problems that might be occurring there that then create the appearance of a leg length discrepancy. This is really easily solved. And by the way, in 10 to 20% of the cases, it's a compensation for the other side of the body. So there's a problem over here, and so you shift your weight over to the other side, and after time that side says, oh man, I just can't do this anymore, I'm breaking down. So then you develop the side bending problem. Now that you understand, these are the 2 basic patterns that are causing almost all back and sciatic pain. And by the way, both of these can occur together. So you can have both an extension problem and a side bending problem. All right, so what are causing these problems are usually problems in the lower body system. Like I explained in the side bending problem, an older problem here or something that you're compensating for is causing the body to adopt the side bending pattern, which then is causing the sciatic pain. Regarding the extension problem, the arching of the pelvis is typically due to excessively tight muscles in the legs or problems with how you're using your legs. How can we come to that conclusion? Well, if your back feels better with your knees bent, all we've done is remove the forces that are from the muscles that are attaching from your legs to your pelvis, which then changes how your spine is oriented. So this is why it all really comes down to the legs, all right, as the problem. And if it helps you, think about it like this. Think about a rock, and it's a big rock. And so that rock is too heavy for you to move. So you set up this little lever, and the lever has a fulcrum of another rock, and you have this big long stick that you jam underneath that big rock over this little rock, and you pull down on that lever arm to move the big rock. Well, you can't move that rock if you're right at that rock and lifting it yourself. That's why you're using that lever. Well, in this scenario, the spine and pelvis are the big rock. You trying to do something at the level of the spine and pelvis is not going to be enough to make the changes that you need. Instead, you need to fix the lever arms that are working on the spine and pelvis, and that's where the legs come in. The legs are the levers in this case, and what you've just heard from me before is showing you how those levers are and how important they are that are operating on your pelvis and therefore your spine, because wherever the pelvis goes, the spine will follow. Which exercises then should you be using to strengthen your low back and your core based on this approach to understanding back pain? Well, it's really a trick question because, like I just said, if we're strengthening the low back and the core, that's like trying to move that big rock with your fingers, right? You need to fix the lever arms that are operating on the pelvis and the core and the spine instead. And so that's what fixing the problems in the legs will have much more effect on the pelvis and spine than anything you can do to strengthen the lower spine or the pelvic or the core. In fact, I almost never do core strengthening or back strengthening exercises with any patients with back and sciatic pain because the problem isn't due to weakness in the core or the back muscles. It's due to lever arm problems, just like that example we talked about. That's what my programs do, is solve all the lever arms that are working on your pelvis and your spine. This is much different than most other traditional treatments that are focused only on your muscles in your back or the discs or the nerves that are actually in the spine here, or maybe the SI joint or the pelvis in some way. But from my understanding, from my point of view, working here does not get us really lasting results. Or the person will have to work here forever and ever and ever because the lever arms have never been truly addressed correctly with regards to the back or sciatic or SI joint pain. So if you're looking for something new to solve your pain and you're tired of going in these circles of trying to find the exercises that will strengthen or whatever you feel you need to do for your back or your core, this is why you can't find the exercises that are good enough to strengthen your back or your core. Because you're working at too close to the center of the problem when the lever arms are the actual problem. So if you fix the lever arms, you'll never have to look at another YouTube video again of someone saying that they have the exact strengthening exercises that you need to solve your back and your core. That was a little trick I played because this is the question I get all the time, and it's actually the wrong question. The question should be, what are the exercises that will solve my back and sciatic pain or SI joint pain? Well, all of those exercises are found in my home programs. And I'm not being crafty by not going into them because hopefully you understand now through this explanation that it's more than just a tightening or a weakening of muscles that's occurring. It has something to do with older injuries and your compensation patterns around those old injuries. It has something to do with the movement patterns that you've created that have caused stress to these areas. It also has a lot to do with tension that's occurring in your body that's occurring often from head to toe. And finally, it may even be that you can't really change these things without the use of some external help or tape. And that's what all my programs all feature, these solutions. Tension reduction that are occurring in patterns that are creating this pain, fixing the tight or weak muscles, fixing the habits and how you're using your body that's causing all of this problem. And for those of you who have a hard time changing your habits, using tape to bridge the gap in function until you can change those habits yourself and solve those tight or weak muscles. They are very comprehensive programs. They work very well. They are very powerful. If you're looking for something that will finally solve your pain, instead of chasing down little exercises to try and strengthen something that really isn't the problem, then my programs are exactly what you're looking for. I hope that helps, and thanks for listening.